Welcome to season 3 of the Level Up Infection Prevention podcast with me, Michelle Strange. In this season, we're diving deeper into the nuances of infection prevention, HIPAA, OSHA, and just patient safety as a whole in the dental setting. And each episode will tackle specific topics with, I think, incredible guests to bring you practical insights and solutions and hopefully some valuable strategies to elevate your practice. And today we're going to be discussing HIPAA, which I know you're like, Michelle, but I promise you need to hear this message with my guest, Amy Wood. Hello, Amy. Welcome.
Hello, Michelle. I'm so glad you had me. Come on, this.
You have in your presentations, I've heard you say there's no PP in your HIPAA pool.
Yeah.
And that is literally the only reason I can spell HIPAA properly.
I've tried a whole bunch of different things. I've tried open up and say, like physicians
Oh,
tell
that's a
you
good
and,
one
and
too.
dental professionals tell you, but nothing really stuck until I
It's in
did
my
the.
brain now, forever and always. So because
Yeah,
of
and
that.
it's not from me. A colleague of mine that I work
I
with
love that.
on a joint task force with the federal government, we're literally creating the guidance for cybersecurity for small practices. She says this, and so a friend of mine in Atlanta, she said it. I just happened to have my oldest child, who's very artistic, draw a picture of that, and she just so happened to draw a picture of me as the expert on the side of the pool saying this in the thought bubble. And she gave me hankles and
Oh,
armpit hair and a judgmental stare.
you gotta love the children, like, they give you no breaks.
No, no, teenagers are mean, especially
There's no
teenage
breaks.
girls.
Oh, well, so we're gonna be talking about HIPAA. I'm curious, like, where did this start for you? And then I'd love to dive into some, like, just quick and dirty things you hear often, solutions you're often given, I would say.
Yeah. So my husband and I had been working as dental IT providers in Northern California at that point for about 11, 12 years, something like that. And I decided with two kids under two, let's throw
Oh
in major
gosh.
upper and lower orthodontic surgery because that sounds like fun. And about a year later, I got a letter in the mail saying that my x-rays from that surgery and the series of x-rays and panos ended up for sale on the dark web because someone at the imaging center uh, didn't understand the value of x-rays. This lady said the same thing that every dental office says to me. Oh, it's just x-rays. Who cares? And unfortunately, my name, birth date, social security number, and my insurance medical record number were on those x-rays. And since then, I've had financial identity theft, which is super fun as a business owner. And I've had medical identity theft where someone impersonated me to try to get surgery. And so it's just, and it will never go away. Once it's out there, that information is sold and resold and repackaged. And, I realize that our dental community ignores this particular topic. They want quick and easy. And you deal with this with infection control too.
Oh
It's,
yeah.
I want to be able to check the boxes to the minimum
Mhm.
necessary and move on with my day. I have other things to do.
Wow.
And sadly, with HIPAA, it's changed so much just in the last 10 years. How just in the last 2 years, it's changed so much that we have to stay on top of it. And it's almost unfair to try to give that task like yourself that's doing infection control or OSHA for practice because, about 2009, those regulations really started increasing and adding more and more and more. And they kind of, they did this and you kinda can't be an expert in both anymore. Like, I will never touch
No.
your topic. It's
No,
too
and
much.
in fact, anybody who even asked me, like, "So you do OSHA, infection control, HIPAA?" I was like, "Oh, no, 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 not I. Not I. Let me send you to the people that really understand it." I personally wanna be the end user that's, like, knowing the things. I am not here to teach it by any means, so I'm so grateful that you are spending so much time and effort to learn it, especially because I did not realize there was some changes in the last 2 years.
It's mostly cybersecurity based.
Okay.
And there's actually some new regulation and guidance coming out in spring of 2025 that is surrounding new information, such as artificial intelligence, and just
Oh, that makes sense.
to put in some guidelines around it, what we can and can't do with it. And, a couple of years ago, it was surrounding telehealth and being able to use remote workers, whether they're US based or not. And so every time a new technology becomes available to healthcare, we have to put some guardrails around what we can and can't do with it, or should and shouldn't do is actually a better phrase.
I actually just to digress really quickly here, because I love teledentistry. What are some things that I could be doing wrong with that within that teledentistry? Now, I do use a software program that is encrypted. I only do my video calls within that, text messaging within personal information, or if I'm sending things to them like their records or their treatment plans or whatever, I do it within that software. Is that right? Am I still doing
Yeah.
it correctly?
So what happened is when we had that nasty little bug that went around that we don't want to mention in 2020,
Mm,
that's like a four-letter word, but
the
longer.
panini. I always say it's the panini that got us all.
Yeah, it was special. It was a lot of swear words is what it was.
Yeah, it was, yeah.
And during that time, people were at home and the dental practices were closed for safety. And during that time, you still had to be able to communicate with patients and be able to see what was going on. And we found that, especially in smaller healthcare, especially in dental, they were doing all kinds of wrong things. So the federal
Mm,
government, Health and Human Services Office for Civil Rights, came out with some guidance. And they are very, very careful about never mentioning vendors specifically. They want to be agnostic and let you
sure.
choose which vendors you want. But they came out and said you have to have a healthcare specific, HIPAA compliant healthcare platform like Zoom for Healthcare, Doxy, stuff like that. And you also had to have a business associate agreement with them. But then there were other platforms like Free Zoom. Should you be
Right.
using it? Probably not. Can you use it? Yeah. And with technology, I think a lot of people tend to forget that
Mhm.
we're using
Okay.
it.
What are the common kind of mistakes are you seeing, especially with technology? Like, is it the text messaging that becomes an issue? Is it still emails not being encrypted? Is
all,
it people talking about patients when they shouldn't be talking about patients?
all of them.
All of
Yes.
it? Okay. We don't
I
learn
see.
apparently.
No, well, so here's the interesting thing. So I'm an elder millennial, like I'm one of those cusper kids
Same, same.
that's, you
Yes.
know, technically an elder millennial, but I have a lot of Gen X traits in me and, drank from the water hose, went outside and played
Oh,
until the
yeah.
lights came on.
Lights came on for sure, for sure.
Yeah, yeah. Parents kicked us out because they didn't want us in the house.
Chronically outside.
And I'm pale. We didn't like to be outside, so I was always looking for shade. And so we have to remember that when HIPAA first came out, it was all privacy based. And so
Yeah,
we spent a lot of time and effort on that kind of education from 1996 until about 2009. And you have to remember that there's a whole new generation of kids that weren't born in the 1900s, which, makes me feel extra old saying that.
I'm like, I am always offended when I hear that.
Yeah. I had a kid
I
at the
mean,
grocery
so
store.
accurate, but so offensive at the same time. How dare you?
I was trying to buy a bottle of wine, a couple months ago, and this kid was looking at my ID, and I barely
I know where
pulled it
you're
out,
going.
and he said,
They're like
"Oh, I know you're old
19.
enough. The first letter or the first number in the year is a 1." And I was like,
Okay, child. Okay, embryo. Okay, moving on.
"Yeah." So, anyway, we have this whole new generation of kids that didn't grow up with privacy.
Mhm.
Their parents were always putting everything on some kind of social media, whether it was Facebook or MySpace, depending on how old they are. And they never grew up in an era where privacy was just an expectation. And now we have
Right.
this regulation where all the education now is focused on security and technology. And privacy tends to be forgotten, or it's very, very small aspect where it's like, oh, just don't share information, don't go snooping, don't post personal stuff on your personal social media, stuff that relates to the office. And so they just kind of gloss over it now. And what we don't realize is these kids don't understand it. And I say kids, they're adults, but the younger generation is coming into a practice and they're the ones that are screwing up simply
Oh,
because they don't
that's
have the education.
interesting. So the
Yeah.
ones that are screwing up the young ones, like employees or patients? Employees.
Employees.
Got it. Because they're just so quick to like snap a picture
Yep.
while they're working, put it online. Then you got patients' shoes in there, their purse, and like, okay,
Oh,
I
the
can see
worst
that.
one I had was this girl was coming in and taking her daily Instagram selfie, and it was in the lab, and right behind her was the daily schedule printed out. And it
Oh,
had all the
yeah.
names and
Mhm.
phone numbers and what treatment was being done and the dollar value of said treatment and any other additional notes. So every day, if you zoomed in, you could see right behind
Oh,
was
wow.
a day sheet.
And that is something that I, as somebody who posts a ton online and creates content for, I'm always like, if the x-rays are up there, they're like the test x-rays, like the random ones which sometimes aren't even teeth. They're just things that we tested the x-ray machine on, making sure that I turn the screen off so that you can't see the schedule. I grew up in the days of it where we had like the schedule, like actually tacked to the wall.
Yeah.
And like how much trouble we used to get in on that because somebody walking out would be like, "Oh, Jane's coming in today. I know her." And we're like, "Oh, HIPAA."
Big word.
Yeah. And so now, like, we got screens everywhere in the offices and the operatories. So making sure that you're not pulling things over from different parts of one screen to the other. Like, I find myself really having to be diligent to not share people's stuff because there's just so much technology
That
right
you were
now.
trained to do that, and
I
I
mean,
think
I listen to people like you that tell me like, "Look, you should second guess that content that you put out." I'm like, didn't even think. Thank you."
stop doing dumb things. I really don't like doing
Yeah,
data breaches.
I exactly. And like, I would never want to have my stuff like we see this a lot too, where now we hear people talking about patients after the fact. And even when I do talk about patient cases, I'm really specific about trying to use a they them. So it is a little bit more gender neutral. And then really talking about it so obscure almost that you wouldn't even know like what office is it from this year? Is it from like where could it be? And really just kinda keeping the helpful information to a minimum or maximize the helpful information, the patient data to a minimum.
Actually, an aspect of HIPAA, it's called minimum necessary to get the point across
Oh,
or to
okay.
do your job.
Tell me more about that. So, that just essentially what I was just doing is,
Yeah,
just
so that's one aspect. Think, appointment reminders.
mhm.
Those text messages that are going
Oh,
to patients are SMS messages. They're not encrypted. So
right.
you have to, well, those companies that are doing it, not you and I, but the companies that do appointment reminders have to share the minimum amount of information necessary to get the point across and no
Okay.
more or no less. So it's there, you have an appointment tomorrow at 4 o'clock with, Jones Family Dentistry or whatever it is and, please arrive 15 minutes early or whatever it is. But when people will send text messages through the office text messaging system, sometimes
The
they'll say, "Hey, we need an updated insurance card. Can you text it to me?" That's not the appropriate method.
Oh, okay.
Yeah.
Doing it inside of something that I use for teledentistry where it is encrypted and HIPAA compliant and all of that, that's better. I did hear one time from a dentist during the panini epidemic. We he I was actually interviewing him and he said something like, if you tell them that this is not a safe like, not safe, how did he say it? Like, if you shared your data here or you shared your information here, there's potential for a breach. Would you like to continue? And they say yes, then you're kind of releasing your,
Yes
I
and
guess,
no.
liability. Okay. Tell me more
Uh,
because that has never sat well with me. And I was like, oh, so we're just letting people who are probably in pain and just making bad decisions to get to a place where, like, just help me. Then just say, yeah, like, and at this point, like, sell my data. I'm in so much pain. You know?
Yeah. So think like website. So you have a contact
Right.
form on a website
Yeah.
and generally those communications are not encrypted either. So how do
Right.
you get someone to contact you without sharing some level of either personally identifiable information or protected health information, often the two lists overlap. A
Mm,
name, an email address, date of birth, those things are identifiable about a person. It's also protected health information under HIPAA. So we have, these multiple lists and we have to look at how to protect it. So that would be a reasonable and appropriate solution to have a little checkbox to say, I will not share too much,
understand.
but
Okay.
also as the website person, the person creating the website, I will not ask for too much information as well.
Okay.
And that's something that doesn't exactly happen these days.
Okay. Not
Yeah.
really. Okay.
But the doctor that said that, he's not technically wrong, but it does make him kind of a jerk.
That's what I was like, are we just walking the line on like
Oh,
just
yeah.
morality here?
Oh, yeah. I
Like
mean, I
just
work
like,
at
so that
the
your life is easier?
Yeah.
Okay.
I mean, so I teach California law and I have to teach ethics now. And was kind of joking with the dental board, like, can I just have a don't be a dummy? Can
Yeah.
I have that be a slide? And they're like, no, 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 we have to do this because we have this person do this and this person do that. And so now when I teach that class, I'm like, okay, so here's the thing. We have to spend 15 minutes talking about ethics because this line that you guys are not supposed to cross, you guys are dancing all over that thing trying to find excuses to just get away with bad behavior. So, how about we just stop it, do the right thing, and guess what? It costs less and takes less time,
Right. Like
as
just
you
come up with
see
a
too.
system, come up with a protocol, stick to it,
Yeah,
be done with it,
not
right?
that hard. We're
Mm,
always trying to push the limits. And like, I wish I didn't have a part of my business that did reactive work. I wish I didn't
mm,
have to do data breaches, but people keep doing preventable things. And I don't know if it's old education or just I don't want to do it, or it's scary and confusing, or the salesperson told me this thing instead. I don't know what it is collectively about the dental industry, but it is way harder to keep people honest and compliant.
So tell me more about your side of the business that is reactionary. Like,
Ugh.
so when you say data breaches, like what does that mean in the grand scheme?
So it's basically unauthorized access of patient information. And that could
Okay.
be a stolen server, it could be a
Whoa.
cyber incident, it could be hacking into a cloud system, it could be someone disposes of old paper charts incorrectly. I mean,
Okay.
that does happen.
Yeah. I'm like, isn't there a whole service for that? Like that just makes
Yes,
me
but that costs money.
like of course. Yes, yes, yes. I don't even know why. That was such a dumb question. Thank you. Yes.
You
Okay.
heard it after it came out, right?
Yeah. I'm like, it just there's a service, but it costs money. Got it.
Yeah, I mean, and I've had people making mistakes. I had one very interesting one in the middle of those fun years in 2020, and the office manager had been terminated, but at some point during their time in the office, they had logged into the personal Gmail, so personal Gmail, like email service, and it
Yeah.
linked the Google account to the office's Google account. And that's where they saved all their passwords to get into their insurance carriers, their email, their bank accounts,
Oh, okay.
everything.
I'm
That was
following.
their password
Following.
manager. And so when this person was terminated, they were able to get access to all of that from their home computer. And so just very simple things that people don't think about because when it comes to computers, I mean, like I've dealt with this as an IT provider for a long time. You look at a computer and think a computer is a computer is a computer. And I have one at
Right.
home, so I know how to do everything on it. And especially
Mhm.
after the last few years, everyone figured out how to do Zoom. So everyone's a computer expert now. And you can go buy a computer at Best Buy or Costco, and it's all the same, right? And the thing is, we're dealing with dental, and dental software is old and persnickety and it doesn't always work well together. And so it really does need to be engineered as a solution overall, not
Mhm.
just piecemeal. And so when I was doing IT, that was probably one of my biggest frustrations is everyone considered themselves a computer expert in the office because they had a computer at home and they could click next,
That's
next, next install.
so funny because there is not a world where, like, well, I guess when I would log in with IT people and work with Dentrix stuff and things going down, blah, 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 all the time, I was like, "Take it over, take the mouse. I don't wanna do anything. I don't wanna touch anything. I don't wanna be in trouble for anything." 'Cause I was so afraid of somebody hacking something, but again, maybe it's just my age too. I am on of the
Well,
age where I'm like, I grew up with internet. I've seen it be problematic. I've seen it be amazing, so I walk the line.
yeah, we're of the era when we ran updates on our phone, Pinterest would break, and that was
Uh,
all that was important to us.
oh, good old Pinterest. It's been a minute since I was on that one. I
Oh,
and
I'm
there was
still
a
on it.
yeah, I probably don't need to. I need nothing else to steal my time to numb out on. So I'm curious in our like final moments today, are there any like key takeaways or anything that maybe like once they listen to this, like go check this out. And if you don't have a solution to it, like call me.
I think my biggest piece of advice is it's not going to be quick or easy, and it's not going to be just a checkbox, and it's not just a class. It's an
Mm,
entire process and program that goes into your office, and it encompasses a lot. It deals with your people, your policies and procedures, your process, and your technology, and they all have to work hand in hand in just the right way in order to be secure and compliant. So that when something goes wrong, not if, but when it goes wrong, it's going to be a little bit of a minor inconvenience for that day instead of a major catastrophe and a call to me for a data breach.
yeah. And what you'll hear in this season of podcasts over and over again is protocols and processes and why SOPs and standard operating procedures for anyone listening to this for the first time are so critical, and you'll hear it when we talk about infection control and your equipment maintenance. Now you're hearing it with HIPAA and your security and your IT. Like, it is so important to have these things written out, these protocols defined. It is a ton of work up front, but if you make it a living document, it can be updated, and it's so much easier to do that than have this like, "Oh my gosh, I'm gonna have to shut down," or whatever it might be, like and dentistry is so bad. We do not have these things. Like, we have so much work to do with our processes and protocols, and when somebody actually gives me an SOP, I'm like,
Great. One
"Look at a
more thing to do.
unicorn. Who are you? This is amazing." Or even wants to hire me to help them write an SOP for infection control. I'm like, I mean, good for you, and I hate that that's the exception to the rule in dentistry, right? Like, we're just
Well,
all
I think
behind.
dentistry in general, when it comes to certain aspects of healthcare, they want to be part of mainstream
Mhm.
healthcare, mainstream
Yeah.
medical. But when it comes to other things, it's like, oh no, but we're dentistry.
Like, we're different. We're different.
They're not wrong, but it makes it so much harder. Like, I do, fractional compliance officer work, and so when I go into an office on that level and I mean, I've even done that with really small offices, and I prefer it that way because if I can go in and say, "Give me a couple hours of your time, I'll get the team up to par with what they need to know, make sure all the paperwork is done correctly, and help the team integrate everything," it's just done for them, and it's always the office manager that comes back and says, "Oh my gosh, you made that so easy. I don't have to think about it. It's just done now, and it's just part of our day." And then when something goes awry or they have a question or anything, it comes back as, "Hey, I have someone on my team that's an extension." And so it's like the old adage, I
I
got a
got a
guy for
guy. Yeah.
everything, and it's probably a
Yeah.
girl, but I'm the
I got
guy.
someone for that. Yeah. No, that is very helpful, and so if anyone is like, "Oh my gosh, I have some work to do," how do they find you, learn more from you, get
So
started with you?
my business is Copper Penny Consulting, and I'm all over social media too. We do a lot of that: Instagram, Facebook, LinkedIn, whatever your favorite social media is, or our website, copperpennyconsulting.com. And even if you spell it wrong, it will redirect to me. Or my email is HIPAA at copperpennyconsulting.com. Again, if you spell HIPAA wrong and you don't spell it with 2 A's, it will still come to me,
You
but please
thought
spell
of
it.
everything.
You know, when you deal in risk management, you have to cast a wide net and make sure that you're addressing all the possible scenarios. And yeah, half the time I have to think like a criminal. What could I do? How could I get in? How could I manipulate this to my advantage if I were
Yikes.
unethical?
Yeah.
So, good news for dentistry is I actually am ethical. I'm a
I
good person.
we
So,
appreciate that. We appreciate you
yeah.
helping us not be criminals or let criminals take advantage of us, because that's the worst part. I think at the end of the day, so many of us are just ignorant and not hurtful. We just
Yeah.
don't know.
I
And it's
don't think
nice to
it's
have somebody
malicious.
guiding us. Yeah.
Yeah,
Yeah.
it's not malicious at all. It's lack of education. It's the information that's available to dental
Mhm.
practices right now is limited. So, I mean, like I could spend hours and hours and hours going in depth into everything, but the reality is no one's going to retain that information. So,
Right.
if I can hit the really good highlights to change behavior, I found that, when I talk about people, process, and technology, most people say it's technology, process, and then people. And I do it the other way around because if you invest in your people and you talk about things very carefully and very clearly with your team, the processes will fall into place and the technology will reinforce what those policies are.
Nice. I like that. Well, I hope everybody learned a little something today. I hope you connect with Amy because she's actually going to be helping me in the future. And I'm really excited for that. And I appreciate all of your information and your time today coming on and chatting with us.
Anytime.
Thank you for listening to season 3 of the Level Up Infection Prevention podcast. Don't forget to follow or connect with the guest. And while you're at it, follow me on Instagram, Level Up Infection Prevention, and check out levelupip.com for more details on all the digital courses and the Infection Control Coordinator's Guidebook.